Hello, everyone. Welcome to a series, a podcast where we discuss everything healthcare. I thank you for subscribing to my channel. And if this is your first time, kindly click the subscribe button below so you can be notified when I upload new interesting episode. I remain your host, Sonny Clement. Today, we're going to be discussing a topic: 10 reasons why federal government of Nigeria must end out-of-pocket medical expenses as a matter of priority.
This podcast is sponsored and brought to you by HealthShare Integrated Solutions.
The first one is it is a financial catastrophe for families. Out-of-pocket healthcare expenses often lead to significant financial burdens for families, especially those in low-income brackets. Many households are pushed into poverty due to high cost of medical care, leading to high long-term financial instability. When families are forced to pay directly for healthcare services, they may face catastrophic health expenditures that could consume large portion of their income and their savings, leading to sales of assets or borrowing at a very high interest rate, further exacerbating their financial woes. Number two is limited access to essential healthcare. High out-of-pocket expenses create barriers to accessing healthcare, particularly for poor and vulnerable populations. Many people are unable to afford even basic healthcare services, leading to untreatable illnesses and preventable deaths. Sometimes, when faced with high costs, individuals may delay or avoid seeking medical care altogether until their condition becomes critical, leading to worse health outcomes and higher treatment costs in a very long run. Number three is impact on public health. When people cannot afford healthcare, diseases may go untreated, leading to outbreaks and increased public health risk. The inability to pay for services like vaccination or treatment for communicable diseases can also have widespread consequences for the entire population. High pockets in the cases of maternal and child mortality. High out-of-pocket expenses contribute to high mortality, maternal and child mortality rates in Nigeria, as many women cannot afford prenatal care, safe delivery services, or pediatric care for their children. And this is part of reasons why this is very important for federal government to quickly and intervene and bring an end to out-of-pocket expenses in Nigeria. The number 4 point is economic burden on the healthcare system. Out-of-pocket payments often result in inefficient allocation of resources, with patients choosing cheaper, less effective treatments, or even self-medicating. Most Nigerians sometimes if they cannot afford their medical bills, they resort to self-help by self-medicating. This is not only jeopardizes the patient health, but also strains the healthcare system when complications now arise from such kind of behavior. Another point is overburdening public hospitals. And what I mean is, as out-of-pocket expenses rise, more people may avoid private healthcare providers altogether, leading to overcrowding in underfunded public hospitals, which are already stretched thin. Number 5 on my point is human rights and equity concerns. Access to healthcare is a fundamental human right, and relying on out-of-pocket payments undermines this right. The inability to pay should not be a barrier to receiving necessary care at all. Out-of-pocket expenses exacerbate inequality in healthcare access, as only those who can afford to pay receive adequate care. This creates two-tier systems where the rich get quality care and the poor are left behind. It is such a shame that only about 6% or 6-7% of Nigerian populations have one form of insurance or the other. It's such a shame. Number 6 is encouraging universal health coverage. Ending out-of-pocket expenses is crucial for achieving universal health coverage, where everyone has access to healthcare services they need without financial hardship. It aligns with global health goals and commitments. They can also enjoy some level of social protection, because implementing social health insurance schemes or other financial protection mechanisms can reduce reliance on out-of-pocket payments, ensuring all citizens have access to essential healthcare services. Number 7 is reducing health disparities. Out-of-pocket expenses disproportionately affect rural populations often, who often have lower incomes and less access to healthcare facilities. Eliminating this cost would help reduce the health disparities between the urban and people who reside in the rural areas. Then it's also very important for vulnerable populations like women, children, the elderly, and people with disabilities are particularly vulnerable, who are particularly vulnerable to the impact of out-of-pocket healthcare expenses. Ending this payment would protect these groups and ensure they receive the care they need. In fact, this is very, very important. This can also be a way to mitigate, the impact of poverty, to reduce poverty in the country. Because when you can take away medical expenses, medical bills, healthcare, good healthcare is very expensive. So when you can take that particular expense out of you can take the burden of medical bills out of people's payroll. You would be doing a lot to help them save more money than spending what they have on their medical bills. So when healthcare is free at the point of use, individuals are more likely to seek preventable care. It's leading to early detection and treatment of diseases, which improves overall health outcomes. Chronic disease management is another thing, because removing out-of-pocket expenses would also encourage better management of chronic diseases such as diabetes, hypertension, reducing complications and improving the quality of life. Number 9 is fostering economic growth. This is very, very key. Now, Nigeria is at a point where we're looking for a way to turn around our economy. This might be a way out. A population that has access to affordable healthcare is healthier and more productive. This contributes to economic growth, as a healthy workforce is essential. A population that has access to affordable healthcare is healthier and productive. This contributes to economic growth, as a healthy workforce is essential for national development. By preventing the financial ruin that often accompanies high healthcare costs, the government can help reduce poverty levels, promoting economic stability. And number 10 on my list is aligned with best global practices. Most countries have successfully reduced or eliminated out-of-pocket healthcare expenses through government funding, social insurance, and universal healthcare systems. Nigeria needs to align with global best practice to improve its healthcare system. International commitments can also be a way of ending out-of-pocket expenses. Nigeria helped to meet international commitments such as Sustainable Development Goals, particularly Goals number 3, which aims to ensure healthy lives and promote well-being for everybody. So, in conclusion, ending out-of-pocket healthcare expenses in Nigeria is not a moral imperative, but also an economic and public health necessity. By doing so, the federal government would be able to protect Nigerians from financial catastrophe and improve access to essential healthcare services and move closer to achieving universal healthcare coverage. The benefits of such a policy are far-reaching, contributing to the healthier and more equitable and economically stable society. That's all we have for today. Thank you for tuning in to Health Series. We hope you found today's episode insightful and valuable. If you have enjoyed the conversation, don't forget to subscribe, rate, leave us a review. It helps us to reach more listeners like yourself. Be sure to follow us on Facebook, Instagram, TikTok for updates, and to join a growing community of health series. If you have any questions, topics, or you'd like to cover, or guests you'd like to hear from, feel free to reach out to us. We'd love to hear from you. Until next time, stay informed, stay healthy, and keep exploring the world of healthcare with us. Thanks for listening.
This podcast is sponsored and brought to you by HealthShare Integrated Solutions.